Hi everybody, my name is Dr. Jennifer Aaberg and I'm a dentist over at Park West Dental in Channing, and I've been doing a video series celebrating my 3rd year anniversary since joining this amazing practice. In this video series, I've been offering a whole bunch of little tiny small prizes related to some of my favorite hobbies outside of being a dentist. As well as offering a new patient special where if you schedule a new patient exam at our office this April, you'll receive a free Oral-B electronic toothbrush. This is one of my favorite electronic toothbrushes just because of the size and shape of the head. You can get into the nooks and crannies behind your back molars especially, and I just love the motion that it does. I feel like I get my teeth really clean with this brand. So if you're in need of a brand new toothbrush and a new dentist, give us a call at 208-522-1164. And if you're one of our amazing existing patients, if you refer a friend or family member who makes a new patient exam with us, you can also receive a free electronic toothbrush. So give us a call. And for the prize for this video is a set of hot hand warmers and toe warmers. So I love the outdoors. My husband and I do a whole bunch of hunting and camping and fishing. When the weather is even remotely warm, we're outside playing. And so these are a must. Last year we went hunting in November in Wyoming and went elk hunting, and boy were these a must. These helped us a lot when my husband got his elk. So I wanted to offer a big package of hot hand warmers for this prize giveaway. So if you'd like, share or comment this video, or if you know and love us and you give us a 5-star review, you'll be entered into a raffle for this prize at the end of this month. If you are interested in our other prizes, check out our Facebook page. There's other gifts that we're giving away as well. So for the fun dental fact I wanted to talk about for this video is about tooth sensitivity. What can cause some tooth sensitivities, and my first suggestion when someone has suffered from tooth sensitivity. So the way that teeth can feel temperature is through a whole bunch of what we call tubules that communicate from the outside of the tooth to the inside nerve. So our teeth are actually porous, believe it or not. From the center of the tooth there are a whole bunch of tunnels or tubes with little nerve endings and a bunch of liquid that expand and contract based on temperatures. And so when you're drinking cold, it changes the pressure of the fluid on the inside and lets your nerve endings fill that. And so some people who are suffering from cold sensitivity might have a more porous tooth structure or have a little bit of inflammation on the inside of the nerve. One of the common reasons for tooth sensitivity is rubbing a lot of excessive tooth structure away. So aggressive toothbrushers, or more often people who use a very abrasive toothpaste often suffer from tooth sensitivity. So an abrasive toothpaste, like a whitening toothpaste, will scrub some of the tooth structure away, and the pores widen as you go further into the tooth. So if you're scrubbing that tooth structure away, you're making these pores a little bit wider and much easier for you to feel that hot or cold sensitivity. So my first recommendation when someone's suffering from temperature sensitivity is asking what type of toothpaste that they use and just trying to move from a different brand that's known to cause that sensitivity. But let's say that they're using a pretty generic brand and they're still suffering from tooth sensitivity, then I'm going to recommend that they switch to an anti-sensitivity toothpaste. My most favorite recommendation is Sensodyne. I've very rarely had anyone ever complain about Sensodyne. It's a very good, affordable go-to in terms of treatment for cold sensitivity. And the way that Sensodyne works is it has an active ingredient called potassium nitrate. And what that potassium nitrate does is it goes and it plugs up those pores on the outside surface of the tooth and insulates that tooth, so you can't quite feel that temperature difference as much as you would with it being wide open. So the thing about anti-sensitivity toothpastes like Sensodyne is that it takes about 2 weeks for you to notice. So if you've ever used Sensodyne before and you've only given it a couple nights and oh, my teeth are still feeling sensitive, you have to give it time to actually plug up these holes in order to reduce the sensitivity. And then another thing about sensitivity toothpaste, it only works as long as you're using it. So over time, that potassium nitrate can wash out, and then you can regain that sensitivity again. If that's the case, then we can talk about other options that are a little bit less conservative, like fillings or a different type of medicine that it can scrub and cure into those pores. But anti-sensitivity toothpaste like Sensodyne and potassium nitrate ingredients is a very good first go-to for tooth sensitivity. If you have any dental questions at all or looking for a dental exam, you can find us over on Channing Way near the hospital district, or you can give us a call 208-522-1164. If you're interested in any of our other prizes, check out our Facebook page. I'm looking forward to seeing more of you and providing more videos. Take care. Goodbye.